Hi all, our topic is calcium channel blockers. These are the agents which acts on our cardiovascular system. As the name indicates, these agents will block the calcium channels present in myocardium. Classification of calcium channel blockers. These are dihydropyridines and other agents. Dihydropyridines include nifedipine, nicardipine, amlodipine, and nimodipine. Nifedipine is the prototype agent. Amlodipine is the most commonly used agents and these are given once daily. Nimodipine is a lipid-soluble agent, so it can cross the blood-brain barrier. Other agents include verapamil and diltiazem. Mechanism of action of calcium channel blockers. They blocks the L-type calcium channels in the cardiac and vascular smooth muscles. Thereby, it blocks the entry of calcium. We know that calcium is necessary for muscle contraction. As there is decreased level of calcium, so there is reduced contraction of cardiac smooth muscles and vascular smooth muscles. Actions of calcium channel blockers. The agents verapamil and diltiazem, they mainly act on calcium channel present on heart. Dihydropyridines, they mainly act on arterial smooth muscles or vascular smooth muscles. In myocardium, calcium channel blockers generally act as cardiac depressants. That means it reduces the cardiac activity. Thereby, calcium channel blockers will reduce the heart rate, force of contraction, and AV conduction. Calcium channel blockers also act on vascular smooth muscles. They mainly act on arteries. Reduced level of calcium will lead to reduced contraction, so that will lead to relaxation of vascular smooth muscles. So calcium channel blockers produces vasodilation that will result in reduction in peripheral vascular resistance. As a result, calcium channel blockers reduces heart rate, reduces force of contraction, and reduces AV conduction and peripheral vascular resistance. The overall effects will lead to fall in blood pressure. As a result of fall in blood pressure, our body will maintain the heart rate by increasing the heart rate. So, calcium channel blockers will lead to reflex tachycardia. Tachycardia means increase in heart rate above 100. Other actions of calcium channel blockers that will lead to relaxation of bronchus and uterine smooth muscles. Amlodipine, which is the most commonly used calcium channel blocker, it has certain advantages over nifedipine. It has high bioavailability, longer duration of action, so once daily dosage is enough. Can cause palpitation and reflex tachycardia, but compared to nifedipine, The chance of palpitation and reflex tachycardia is very less. To dilate both peripheral and coronary blood vessels. Dilation of peripheral blood vessels will lead to decrease in peripheral vascular resistance, and dilation of coronary vessels will lead to increased blood supply to myocardium. Nimodipine is a calcium channel blocker with high lipid solubility. It can penetrate the blood-brain barrier, so it is used in neurological indications such as subarachnoid hemorrhage. Adverse drug reactions of calcium channel blockers. It causes postural hypotension, reflex tachycardia, ankle edema, flushing. Constipation is more prominent with verapamil. Nifedipine can cause gum hypertrophy. Postural hypotension and reflex tachycardia and edema, flushing, constipation, gum hypertrophy with nifedipine. What are the contraindications of calcium channel blockers? Contraindication means condition in which the drug cannot be given. Calcium channel blockers is contraindicated in case of unstable cardiac failure, but can be safely used in case of stable cardiac failure. Since it is a cardiodepressant agent, it reduces the force of contraction, so calcium channel blockers cannot be given in unstable cardiac failure. It is also contraindicated in case of pregnancy in last trimester of pregnancy because it affects uterine contraction. Uses of calcium channel blockers. There are certain cardiac uses and non-cardiac uses. Cardiac uses are hypertension, angina, and arrhythmia. Non-cardiac uses are migraine, subarachnoid hemorrhage, and preterm labor. Why it is used for hypertension? Hypertension is a condition in which there is elevated blood pressure. By blocking the L-type calcium channels, calcium blockers helps to reduce heart rate and force of contraction. Thereby, it reduces cardiac output and blood pressure. Calcium blockers also causes vascular smooth muscle relaxation that will lead to vasodilation, thereby reduces peripheral vascular resistance and decrease in blood pressure. Another use of calcium channel blocker is angina and MI. Angina and MI is characterized by cardiac damage due to reduced blood supply. Calcium blockers helps to reduce heart rate and force of contraction, thereby it reduces the cardiac workload and reduces oxygen demand, thereby improves the function. It also leads to arteriolar dilation that will result in decrease in peripheral vascular resistance and decrease in afterload, thereby helps to reduce cardiac workload and oxygen demand. It is also used in case of arrhythmia. Arrhythmia means irregular heartbeat. It normalizes the heartbeat by reducing AV conduction. Non-cardiac uses. This used for the prophylaxis of migraine. The commonly used agent is verapamil. Nimodipine, which is a highly lipid-soluble agent, can cross the blood-brain barrier, so it is used for subarachnoid hemorrhage. Nifedipine, is used in case of preterm labor. It reduces the uterine contraction in case of preterm labor, thereby it causes uterine smooth muscle relaxation. Then there are certain drug interactions of calcium channel blockers. We give verapamil or diltiazem along with beta blockers. It causes additive effect. That means both drug will reduces the heart rate and force of contraction. So there is adding of the actions. Verapamil can displace the digoxin from tissue binding site, so it can cause digoxin toxicity. We give verapamil along with sildenafil. Sildenafil is an enzyme inhibitor that will lead to verapamil toxicity because the enzyme inhibitor will inhibits the microsomal enzymes, thereby increases the level of co-administered agent, that is verapamil. So calcium channel blockers, these are agents which blocks the L-type calcium channels in the myocardium and vascular smooth muscles. It helps to reduce heart rate and force of contraction. It helps to reduce peripheral vascular resistance. So it is used for the treatment of hypertension, angina, and myocardial infarction. There are certain non-cardiac uses also. It helps to control subarachnoid hemorrhage, helps to relax the uterus in case of preterm labor. It is also used for the treatment of migraine. The common adverse drug reactions of calcium channel blockers are it causes ankle edema, hypotension, flushing, etc. Amlodipine, which is the most commonly used calcium channel blocker. Thank you.